Okay, nurses, this is a skilled nurse visit note. Okay, so I went to my hotbox, pulled this up. Um, Remember, on every form, you have to put a time in and time out before you can save it and move on. So just make sure you do that. Visit date. Cool thing about this too is you can go back and view a previous note if you want. So if you weren't sure about last time you were there, you can pull that up and it will show you what you put in your last visit, and you can work off of that if you need to. Okay, so there's that option. Okay, so you're going to go through and you're going to fill out your systems like you normally would. Here's your eligibility. Make sure you're clicking all the ones that you did in your start of care. Capture your medication changes if there are any. As you go down and get into your goals and interventions, you don't need to enter the correct mileage. I don't know why that keeps pulling up there. Okay. Goals and interventions. So this will be your plan of care that you created on your start of care. Okay. So if I want to document progress on this goal, that's what I'm going to click. I performed all these. Patient and caregiver, they verbalize understanding. The reason we're having to do a little more work with the goals and interventions is Medicare wants to see each and every visit exactly what we're doing to support us being in there. So we have to speak to the goals that we've created for that individual plan of care, and that we are doing the interventions that we said we were going to do to help the patient through the skilled service that they need. So if you didn't perform one of these interventions, then don't mark it as performed. Okay. Again, if one's complete, then go ahead and complete it. Once it's complete, it's good to go. Okay. Let's say you want to update. So you want to say, oh, this goal is fully met. Okay. You don't have to worry about it. You've updated it all. If you hit the plus sign, you'll see the status, okay, of the goal. Defer will give you a status box. You can whatever you want to write in here. During assessment, unable to assess this, or unable to provide skilled education due to the fact that patient's caregiver was gone and patient has dementia, or whatever. So you can defer for a goal and intervention if you want to. And once you fill in what you want there, you can submit that. You can document the progress. Once you've gone in and performed the goal and submitted it, you can even attach your percentage to it. So let's say we're 40%. Okay. So this will be what you do as you do your visits. Again, goals and interventions on this new system will be a little more in depth, take a little more time. But again, it's because Medicare, they are cracking down hard on interventions and goals to actually see that we're doing what we say we do on each one of our visits. So as you work through all this and update what you did, then you can return to your visit note. Okay, it tells you what you did, skilled intervention, saying Medicare, I went in on this visit and I addressed this goal with these interventions. I addressed these goal with these interventions. I didn't address this goal, so on and so forth. Okay. Another one is coordination plan. They're hitting hard on coordination plan. So if I'm an RN, I conferenced with Jeff PT regarding plan of care, or regarding a patient fall, or whatever it is. Okay. Plans for next visit. We're going to continue plan of care, discharge planning, post-surgical activity, and let's say incision management. So those are things you can put down for all that. If you use supplies, you're going to hit your supply worksheet. Okay, that's part of your start of care. You'll build a supply worksheet in your start of care of supplies that you might use. I built on this patient, I'm going to use a 4x4 for an incision. So I did a dressing change. So we used one. If you've given them various dressings, let's say 4, you can capture those in your skilled visit note, so we can get reimbursed for those as well. These are only on non-routine supplies, so you can't capture gloves or typical gauze. It'll be a special type of gauze or wound supplies. So we'll capture the 1. So now we save that. Now it will come up in the billing that we did use 1 supply. And then again, you're going to do your electronic signature and date, and then you're going to submit it. If you don't, if you don't select this, it will, if you don't do your e-signature is what I'm trying to say here, then it won't submit it. See, it says you're not valid. So you've got to do your yes. I'm okay with that. There we go. Okay. So now it came in as submitted with signature. So now that will be QA'd, and if something needs to be changed, it'll be sent back to you. If not, it'll be completed. So that is a skilled visit note.